Hey, welcome to Medical Stuff. My name is Mark. Man, I gotta pee, Frankham, and that is Chris Kingston over there.
That is Chris. I did pee. That's what I thought you were going to go with that.
The sad part was he didn't get up and go to the bathroom.
No.
And this is why I won't change chairs with you.
Yeah, this podcast will be quick.
Because it's getting cold quickly.
Oh, we're talking about the renal system today.
Not the penal system.
No. But
this has nothing to do with jail.
No. Well, I mean, it depends, I guess. It could. I mean, you can catch any disease in jail. But no, the renal system. The renal system is probably, I guess, most famous for your kidneys and your bladder.
Yeah, do I have renal insufficiency? Depends.
Yeah. It's...
Chris is a little tired.
But you know, man, we're gonna rock this. Yeah. So your renal system. So your renal system consists of, well, I guess technically it'd be 5 primary organs, but you have 6. So you have each kidney, each ureter. Those are tubes going from the kidneys to your bladder. Your bladder. Then you have your urethra, and that is a tube that goes from your bladder to the outside. So if you're a man, that's going through your penis. Anyway.
What if you're not a man? Chris?
You know, I don't define genders, Mark. Anyway.
You defined man.
That's true, I did. Anyway. I just don't want to say it now, just out of spite for you.
Chris is blushing. Anyway, back to the episode. Let's do this.
Right. So, that is your renal system. So what's your renal system's job? Well, it has a couple of jobs, and we're going to talk about those. But your renal system's job, including all those organs partake in excreting waste, particularly waste that comes from your bloodstream. Okay, now this waste can be excess electrolytes. It can be toxins that have been filtered out, and we're now getting rid of them. It can be excess fluid that your body doesn't necessarily need. And a lot of this work, a lot of the muscle behind that comes from your kidneys. Now, when I say kidneys, most people out there can get a good idea of what your kidneys look like. If you've ever seen a kidney bean, well, that's pretty aptly named. It is pretty much the shape of a kidney bean. They are located in what they'd call the retroperitoneal cavity. Fancy word of saying essentially your back. So when people say, gosh, I've gotten hit in the kidney, and they're holding their side, your kidneys are actually located more closer to your back than they are there. So what do your kidneys look like on the inside? Okay. Well, if you were to take a kidney, and don't try and find this out yourself, right. Take our word for it. Right. Or Google a picture.
Although we are big fans of self-education,
we are.
Do not cut a kidney out of yourself or anybody else to verify the information we're about to give you.
I think there's horror movies based on that.
Right. Or at least social, societal myths.
Yeah.
You know, about, you go to a third world country and wake up in a bathtub with your kidney missing.
Right. Yeah.
You know.
Nah, that'd be So, anyway, so if you were to slice a kidney open to where you're looking at just inside the kidney, what you're going to see is you're going to see a collection of, I guess you could say they almost look like pieces of pineapple, like from canned pineapple.
Yeah.
Those are arranged, and those are called that's called the renal medulla. And inside that, you have these little tiny cells that are these filtration cells, and I'll get to those in a bit. But then you have something called the renal pelvis, which to me does not give a good descriptor of what it actually is. The renal pelvis is an area in your kidney that essentially collects the output of all those little filters in the rest of the kidney. It's shaped like a funnel. It is hollow.
Right.
It collects water, and that's what connects and goes into the ureter. The ureter is a tube that then goes from the kidney down to the bladder. As far as how blood is fed to the kidney and how it comes away, you have the renal artery, which comes right off your aorta. And you have the renal vein, which goes right back into the inferior vena cava, which returns blood to the rest of the system.
So when you're talking about the aorta comes off the heart,
yes,
wraps around, and comes down pretty much the middle of the center, towards the center of your chest and down through your abdomen. It splits off into your renal arteries, and then just below that, it splits off into the arteries of the legs.
Yeah.
And in between those two can be the most common place where you have a AAA.
Yeah, which is an abdominal aortic aneurysm.
Mm-hmm.
And what an aneurysm is, it's a ballooning of an artery.
Right.
And that causes it to weaken, and it can actually rupture and cause a drop in blood pressure and kill you.
Right.
Boy, that's a happy note.
Right.
So the aorta is huge. It's the size of a garden hose. And the renal arteries themselves are very large arteries, too.
Mm-hmm.
So they can be, kidney trauma, if you're taking a look at the way this system is, you have a large artery that goes down. You have these arteries that come off and are essentially anchored into two fairly heavy, relative to the size of that artery, organs. So if these organs are moved or impacted very hard, it has a lot of leverage to pull on that artery. Rupturing that artery can it's a quick trip to death.
Mm-hmm.
But anyway, so that is the basic anatomy of the kidney. So what do the kidneys do? Well, they have several key functions. So first is the excretion of toxins. We talked about that. This is anything your body has. A toxin, by the way, is anything that your body essentially has no use for. Now, what I'm not talking about, so an excess of sodium is not a toxin. Now, an excess of sodium can be toxic.
Right.
But a toxin is a specific substance that is not used by your body. May not even have a negative effect. Just has no use.
And also, correct me if I'm wrong, Chris, and I'm sure you will.
No, Mark, I let you forget about being incorrect all the time. Me and the internet.
When you think of toxins, you're thinking of a lot of times stuff you've ingested, poisons, stuff like that, and those are actually filtered out in the liver.
Right.
The toxins you're talking about are byproducts of your body's normal function, your waste products that your body creates. One of the main ways it gets rid of them is through the kidneys.
Yeah. And now also, those toxins that are filtered out through the liver, sometimes what the liver will do is they'll turn that toxin into something called a metabolite.
Right.
And what that is a toxin that has been metabolized or processed by the body. And those metabolites may end up in the kidneys being excreted.
As an example of that, if somebody, and do not do this, drinks antifreeze.
I was thinking this exact same example. Go ahead.
The antifreeze is not what kills you. Your body metabolizes it into formaldehyde.
Yes.
That's what kills you.
Yeah. So
what is the treatment for that?
Alcohol.
Yes, ethyl alcohol.
Yeah.
So in days gone by, they gave you so many shots of alcohol every hour because your body will prioritize metabolizing the alcohol over the antifreeze, and then you'll just pee it out.
Yeah.
These days, they put it on an IV pump and pump in the alcohol that way.
Yeah.
Over a metered dose.
So unfortunately, no. If you do drink antifreeze, which don't, but no, you have to go to a hospital. You can't go to the pub. Because
the thing is that by drinking it, you don't get the same absorption. You don't get consistent absorption. Whereas if they can put it through an IV, then they can control exactly how much you get so that you're constantly fooling your body into not metabolizing the other stuff. My
understanding, though, about
antifreeze. Sorry.
Yeah.
Just came to my mind. Go.
Sorry to not to digress, but antifreeze. By the way, there was a period of time where people were using this for suicide. There was a misconception that this was an easy way to die.
No,
it is not.
It is a long-term painful way to die, like decades.
Well, you can't take enough to die within 24 hours.
Right.
And that was the assumption.
That's true about anything, though.
That's very true. But that was the assumption.
Right.
You basically go buy this at an auto store and drink it, and it tastes sweet, and it's a fine way to die. It is horrible.
Yeah, it was extremely painful. Along the same lines, not to digress too far, Tylenol.
Yeah.
People think they can take Tylenol overdose to get attention. It won't hurt them. Oh no, it's a very painful process if you have a Tylenol overdose. Plus, it damages your renal system.
Yeah.
So that years down the line, you're going to develop kidney disease.
Right. So don't do that.
Right.
Alrighty. So, excretion of toxins. It also regulates fluid volumes, which by fluid we're talking about essentially blood plasma and how much plasma is in your blood. And it regulates BP, and part of regulating that fluid.
Right. Blood pressure.
Blood pressure. Sorry.
Yes.
Again, I'm tired. I'm going back to my paramedic lizard brain here. So
I've seen you be a paramedic, and lizard brain covers it.
Gotcha. Perfect. Might be an upgrade sometimes. So how does it regulate blood pressure? So I like to talk about this function because while most people correctly think of the kidney as a filter, its role in blood pressure regulation is actually pretty huge.
Right.
It's pretty substantial. It does this two ways. So one way it does it is by regulating the volume of fluid in your bloodstream. And the way it does this is it takes electrolytes, such as sodium. Sodium's the best example. And determines if you are high or low on sodium. Okay. So sodium, commonly found in salt. And you should do this experiment at home. It's actually kind of fun. Put a little puddle of water on the table. Take a little pile of salt, put it next to it, and you'll actually watch that water move into that salt pile. Well, sodium inside your body isn't any different. So what sodium will do when you have an excess amount of sodium in your bloodstream, it will pull fluid from the cell, it's called extracellular fluid, and increase the volume inside your vasculature. Now, an increase in volume, as Mark and I have mentioned many times, go check out our cardiac episode. Mm-hmm. An increase in volume in a cardiovascular system is essentially a pump, a container, which is your blood vessels, and fluid. An increase in the volume of that fluid can raise your blood pressure. Likewise, if you get rid of sodium and you have less, then there's less pull of the extracellular fluid into the vasculature, and you'll decrease that volume, and that can lower your blood pressure. So, that's one of the ways that the kidney regulates blood pressure. The other way is fairly directly. So, in the renal artery, which is the artery that feeds the kidney, in the arteries that then branch off of that, there are little receptors that measure blood flow. When the blood flow gets low, your kidneys will release a hormone called renin. So what renin will do is renin will interact with another hormone that floats around in your bloodstream called angiotensinogen 1, interacts with that and turns that into angiotensinogen 2. What angiotensinogen 2 does is it causes vascular constriction. And again, back to pump pipes and fluid, if we take that pipe and we shrink it down and it has the same fluid and the pump is working the same, blood pressure will go up. In fact, there are medications to treat blood pressure that stop that process, and that's called an ACE inhibitor. And so we took a lesson from the kidneys there to regulate your blood pressure.
Well, now it also regulates your calcitrol, which is a hormone made from the vitamin D you take that is necessary for healthy bones, among other things.
Yeah, erythropoietin. That's a hormone that regulates the manufacture and distribution of red blood cells from bone marrow.
All very important things to help your body run great. And the thing is, and I've also heard this about the liver, that the liver and the kidney really are the two organs in your body that we abuse the worst.
Oh, yeah.
And
every
really,
shitty thing you eat.
I had an instructor tell me one time that people should go to jail for the things they do, for the abuse they give to their liver. Because it should be considered a criminal act.
Oh, I want to correct myself earlier. I called renin a hormone. Renin's actually an enzyme.
You know what? You're fired.
Damn it. All right. Yeah. Well, this is it for Chris Finkston on medical stuff.
We will have Mark and somebody new next week.
It's really anybody new. I saw some guy walking by the window, Mark. Do you want to see if he wants to?
It can't get any lower. So the effects of high blood pressure on your kidneys, your kidneys regulate your blood pressure. But if you allow your blood pressure to be too high for too long, it can also damage your kidneys.
Right.
And basically what happens is that the high blood pressure damages the actual arteries of that filter, reducing their ability to let blood flow through them. And this can lead eventually to kidney disease.
Yeah, and so another thing you also have to be careful of is when those arteries are getting damaged with that higher blood pressure, the higher blood pressure will also find its way to that filtration system that I mentioned earlier. So let's talk a little bit about the filtration system itself.
Okay.
So you have there's about 1 million of these little tiny filters per kidney. And what these are is these are small structures called nephrons. And nephrons essentially consist of something called a glomerulus. That's totally accurate in how that's pronounced. And that's basically a head. That's the input. And then there's kind of a long tube after that called the tubule. And it's broken up into various sections that have different names. We won't get into those. And what happens is that blood is taken from the renal artery and filtered through these nephrons. And as it goes through a nephron, the nephron, using various, I guess you could say, sensors throughout the body, determines if it needs to take different things and retain those. So for example, some blood starts going through a nephron. What it will do is it will say, okay, do I need more sodium? Yes, I do. I'm going to hang on to the sodium. Do I need less potassium? That's true. I'm going to let the potassium go. Do I need to keep water? Yes, I do. I'll keep some water, or no, I won't.
Well, very interesting when you talk about the potassium. A very common diuretic is Lasix.
Yeah, a non-potassium sparing medication.
Right. So what happens is it makes your body draw the potassium off,
Yeah.
thereby drawing off fluid into your kidneys and you pee it out, thereby lowering your fluid level so you don't get the backup in congestive heart failure.
Yeah. It helps people with the, if you guys have, people or maybe you have swollen feet from congestive heart failure, this is a medication that can help with that. Also helps with, if you ever heard of getting water on the lungs, that's something that Lasix can help with.
Right.
So after it's filtered these things out, what goes into the renal pelvis that I mentioned earlier and eventually is peed out, going down the ureters into the bladder, is everything it didn't need.
Right.
So that includes sodium, potassium, water,
Toxins.
and this is also why urinary analysis tests for drug usage work. It's because anything that's left over, oftentimes metabolites themselves, where the drugs has been metabolized, is now being excreted, is excreted in the urine, and we can test for that.
And yeah, it's not the THC. It's what's left. They're testing for what's left over after your body uses the THC and changes it into something else.
Yeah, and in fact, the company we actually do some in-house UAs. We can't get anything called a positive. We get what's called a non-negative.
Right.
And what we then
we
have
do it
to
just for fun.
Yeah, it's what we enjoy doing.
It's a Saturday.
Yeah, it's a Saturday. Hey, you busy? I got a cup. Anyway.
Pee in this for me.
Let's see what color it comes up with.
Exactly.
Oh, God. Anyway, so in the urinary analysis cup, we get what's called a non-negative. And then what we actually do is send that off to a lab. Because there are other things that can cause those metabolites to be created.
Well, you as an example, poppy seed.
Yes.
Poppy seeds in bread.
Yeah.
Poppy seeds on bagels. If you eat enough of those, they can come up as a test for a non-negative test of opium or opiates.
Yeah, and while the metabolites may be very similar, what they actually do is look at the structure of the metabolite itself to determine the difference.
Right.
So,
or they can also tell the level of which you've been exposed to this. Be it a recent incident I heard about, 2 people tested positive for a drug. One person, they're like, it's such a low number. They may have been around it or in a room where it was just kind of in the air because it was being used. The other person, the statement I believe I heard was, I'd be surprised if he wasn't high on the drug when he took the test.
Oh, yeah. Yeah, that's
that's
a good level.
Yeah, so they can test those kind of things and they can make a differentiation between those.
Yeah, so that's everything that's excreted. Anything that as it traveled through the nephron was determined that was needed for the body is returned to the vascular system and goes out through the renal vein back to the rest of the body again.
Right. And this is the number one reason to stay hydrated. Your kidneys and liver work very hard for you.
Absolutely.
And the best thing that you can do on an easy concept is drink water.
Yeah.
Keep them hydrated so they can do that job more easily. As you become dehydrated, it makes the blood can become thicker.
So, you get electrolytes.
And so you start plugging up those nephron holes and you start plugging up that filter. It makes it harder for the body to do its job. And so they're hard-working little buggers.
And you'll break them.
Right.
Yeah, you'll kill them. So let's talk a little bit about what can happen when the kidneys can't do their jobs, when they can't filter.
Well, also, don't forget about the effect of diabetes
on
kidney function.
So diabetes, just for anyone who's not quite familiar, diabetes is a disease where your body does not effectively handle sugar. So, for example, neither me nor Mark have diabetes. So when we intake food, our body is very good at taking that food and placing it into our cells where it's used as fuel. A diabetic does not have the correct hormones or the quantity of hormones to allow our bodies to take that sugar and put it into cells. So they end up
Right.
with a really high blood sugar.
Right. And so what happens is these are large. So when we digest proteins we eat, the process creates waste products. You have those filters in the kidneys that filter that out. As blood flows through the vessels, small molecules such as waste products squeeze through those holes. The problem is that the glucose that is in your bloodstream is a large chunk.
Yeah, it's a big molecule.
Yeah, it's a huge molecule. That's why you need insulin. The way it was always described to me for the glucose getting into the cells, you need the insulin, which is a gatekeeper, which opens up the cell larger.
Yes.
So that the glucose can get into the cell.
Right.
Now, this is why patients who are diabetic and don't know it will eat a lot of food because they constantly feel hungry because the cells are starving because they don't have the insulin to get the sugar and the energy into the cells.
But in reality, they now have a ton of sugar.
Right, which is why they get thirsty.
Yeah, okay.
Because their body is trying to pee off all of that glucose.
Yeah.
And so they're constantly, and we're not talking thirsty like, yeah, go for a drink of water. This is drinking, filling a glass of water, drinking it down. Filling a glass of water, drinking it down.
Yeah.
This is just an excessive amount of water. So what happens is that you overload that filter.
Yeah.
With all these large molecules of glucose. And then it damages the system because high level of glucose makes the kidney filter too much blood. And all the extra work is just hard on it. It's going to wear down. It's like you're driving your car, it's a manual, and you just don't like shifting into fourth gear. So you make the engine run at a higher RPM for years and years and years. The engine's going to break down sooner, thereby causing your kidney disease.
Right. And when your kidneys aren't able to filter, what also is going to happen on top of that is you're going to retain more electrolytes. You're going to retain things like sodium.
Right.
And when you retain sodium, like I talked about earlier, you're going to be bringing in more fluid into your vasculature, and that's going to cause a chronic increase in blood pressure.
Right.
And a chronic increase of blood pressure, as we already mentioned, leads to further kidney damage.
Right. Of the causes of kidney disease, high blood pressure and diabetes contribute 77% of the causes of kidney disease.
And they feed each other.
Right. And the problem is that after years of abusing those filters, they start to leak useful proteins into the urine. That's why when they do a urine test, what they're looking for microalbumin urine. I can't even say it. Microalbuminuria. Right. I'm going to go with that one. That would seem like the best take right there.
No, that's good.
And so you're actually losing a little bit of this protein that you should have, and that's how they test to see if you're starting to have kidney disease when you have increased levels of this. Now, this is something that 100,000 people a year are diagnosed with, kidney failure. It's a serious condition because the body loses its ability to rid the body of waste. And the waste builds up, it's going to affect all your other systems.
Mm-hmm.
Now,
so a couple other things that can happen with your kidneys. Let's talk about kidney stones, for example. Many people have heard about kidney stones.
Papa was a kidney stone.
What?
No, wait, that's a Rolling Stone. No, mind, go on.
I got right before Rolling Stone came out of your mouth. I'm like, oh, that's where he's going. So kidney stones. A lot of people have heard about kidney stones, and I will tell you, as an EMS provider, having never had a kidney stone, God, that looks painful.
Mm-hmm.
Oh man, that looks painful. If you want a kidney stone is basically a buildup of essentially calcium, but it doesn't have to be calcium.
Mm-hmm.
But it's essentially calcium. So as blood goes through those filters, for whatever reason, the nephrons are taking calcium and pulling it out. And what happens is this calcium gathers in the renal pelvis and forms a stone. And stone is a really good word for what it is. Now imagine taking that stone, which, hey, if it's big enough, could be a pebble, and cramming it out your pee hole.
Well, also on top of that, not only is it large, because kidney stones that really cause problems are greater than 5 millimeters.
And that's, in the grand scheme of the size of your body, that's pretty big.
But it's not this bowling ball shaped thing. It is actually covered in sharp edges, pointy edges.
Yeah.
Think of kidney stones as the snowflakes of your kidneys. Each one's different. They're all shaped very strangely, and they don't, as they go through your body, and they're exiting, they dig into everything around them. You can actually get them large enough that they clog up a ureter.
And they cause severe pain.
Absolutely.
Yeah.
What's the best pain medication for people with kidney stones? Demerol.
Oh, yeah.
It seems to work the best in that situation. And we've transported patients who have kidney stones, and one of the defining things that makes me go, there are some defining characteristics about kidney stones that I look for. Where did the pain start?
Yes.
Where is it right now? Well, it started right back here in my back. It came all the way around it right here in my groin.
Yeah.
Well, that's because it's following that ureter down to the bladder and, out the door. So that's one defining characteristic. The other one is these people can't sit still.
No.
Kind of like me during a podcast.
Right.
Cannot sit. No, these people cannot find a comfortable position. They're trying to get up off the gurney. They're trying to move around. They cannot lay still.
No. And to give you an idea of the pain, now here's the thing. Every kidney stone is different in shape. Every person is different. It's going to hurt more for some and less for others. It's just a fact of life. I have a friend, someone we work with. Her husband has kidney stones on the regular. Mm-hmm. And a lot of times they'll be like, oh, I'm feeling one. Well, here, let's finish shopping and we'll go home. Not that bad for them. Sometimes they're bigger than that. I have gone on women who would rather give birth to another child
than have a kidney stone.
Yeah. Depending on the size of the kidney. That's how painful this is.
And a guy used to work with us, he had some chronic kidney stones. And this is a little bit of a digress here, but he had a stent placed to help them pass for a while.
Okay.
And when the doctor went in to take it out, he basically ran a
coat hanger
clamp.
Oh, clamp. Okay.
Close. There's a clamp with a camera on the end of it up through his urethra, so in the end of the penis. He goes, you're going to feel a pressure as I pass your prostate. Right? He goes, here I am standing in this doctor's office with this doctor running this cable up my penis. I'm threatening to punch him in the head because he's hurting me.
Yeah.
he goes, I threatened to punch him in his head. He said, you're not going to do that. He goes, fine, I'll pee on you. And the doctor goes, you can try. Right? He goes, he got all the way up there and he was taking the stent out. He clamped onto it. And he goes, Mark, I swear to God, when he pulled this thing out, he looked like he was pull starting a lawnmower. Yeah, so even the treatments aren't that pleasant.
Oh, jeez.
Yeah.
Oh, my goodness.
Yeah, he tells a much more colorful version of that, especially his language during the time. But
all right.
So kidney stones.
Painful.
They're very painful.
So what happens, though, when you're... here's the thing about kidneys, though. Once they're shot, they're shot. They don't recover very well. They don't heal very well. Scar tissue is not conducive to a system that is built on many, many, many tiny little filters. So there's a couple different things that can happen. So what happens when your kidneys fail, when they can't do their job? How do we get around that?
Well, initially they're going to be they're going to take care of. Initially, they're going to treat your symptoms. They're going to treat your diabetes. They're going to treat your hypertension, because if they can catch that early enough, then you can delay the kidney disease.
Yeah.
And some people will have kidney disease, but it'll never get bad enough they ever need to do anything else other than treating their body right, which we probably should do.
Anyways.
And they tell you to avoid pop, lose weight, eat less salt, avoid alcohol and tobacco. And getting regular exercise. Boy, there's a central theme in our healthcare system today.
Well, yeah.
Eat better and exexercise.
Ah, damn it.
And it seems like the body works better after that.
I prefer miracle cures instead. I want to wear a bracelet and get better.
Exactly.
Yeah.
Then from there, they're going to move on to medication, stuff like Nephrovite, stuff like that. Things that make your kidneys work a little bit harder, which seems counterintuitive. But you're trying to get them back up to a normal level of function.
Yeah, well, and remember what we talked about is when the kidneys start to fail, that actually creates a cycle that makes the kidneys worse.
Right.
Because if the kidneys are not able to filter out those electrolytes, they stay in the blood and increase your blood pressure, which further damages kidneys.
Right.
So while making your kidneys work harder may not seem like something you want to do, ultimately, it's going to go in there and it's going to break that cycle for us.
Right. And they may, like I said, they put you on an antihypertensive. Chris mentioned ACE inhibitors before.
Yeah.
And by doing that, or treating the diabetes, they're going to minimize the descent into kidney failure.
Yeah.
Some treatments are low protein diets. One of the problems with the diabetes and everything like that is that you have these large proteins and these large molecules trying to get through the plugged up system. So the best way to deal with that is not eat as much protein.
Yeah.
And again, but now never do this on your own. Don't do it on what we say.
That is exactly, yeah.
Everything we're talking about needs a physician, a nephrologist,
yeah,
to be involved in these decisions.
Because normally protein in your diet can be useful. I mean, like anything, too much or too little is bad.
Right.
So, yeah, please don't decide you want to take kidney health into your own hands today.
Right. Yeah, exactly. You want a low protein diet. Don't do that. Speak to a doctor always. Anything you hear on this podcast, go with the doctor over what we say.
Yeah, we should come up with a standardized disclaimer.
Yeah, we should.
Yeah.
We should. So from there, you're going to go to kidney failure.
Yeah.
And that's going to lead you to dialysis.
So dialysis is essentially, instead of having your kidneys do the work, because they can't.
Right.
I say as a kidneys suck, but a dialysis machine is exactly what it sounds like. It is a machine that's going to filter your blood for you.
A hemodialysis.
Hemodialysis.
Machine, which is it's a huge machine. You have to you can do it in the home these days.
That is a new trend.
That is a new trend, but most of the time you're going to be going to a dialysis center where you're going to be there for 4 or 5 hours, three times a week.
Yeah, and depending on your situation, that can be up to 4 times a week.
Right.
As well.
They're also going to have to develop, they're going to have to install, I guess, specific vasculature accesses.
Yeah, Best Buy comes out to your house and does free installation.
Exactly. But these can be called shunts or stents or fistulas.
Yeah.
And basically, a lot of the times what they're doing is they're connecting an artery and a vein together so that they can draw the blood off of your body, run it through this machine. And basically what this machine does is it mimics what your body does.
It's a giant kidney.
It's a giant kidney. It actually has a semi-permeable membrane in there, and then they use a distillate to flush your body. They will also draw fluid, which is what your kidneys do. And patients who miss a dialysis appointment can run into a lot of problems very quickly.
They get sick.
Yes, very, very quickly.
They get sick. They can die.
Right. Well, being in dispatch, if you have a patient who's sick, finger quotes there.
Yeah.
If they have no other symptoms, but they're either a dialysis patient on chemotherapy or they're a transplant patient, we automatically go lights and sirens, because when these people get sick, they get sick very quickly. Absolutely. And they can become septic. Yeah.
And also, damaged kidneys can also affect the duration of medications given as well, particularly opioids.
Yep.
And so when patients who have problems with kidney function, who are also on pain medication, as their kidneys fail, they can end up overdosing. Mm-hmm. Now they haven't overdosed because they took more.
No.
What it is that their kidneys have failed to excrete this medication, so it stays in the system longer. Then they go on to take their next dose as they normally would.
And you're increasing the amount that's in your bloodstream every single time.
Absolutely. So, with that in mind, one of the things that dialysis cannot do is it cannot emulate, or it does not emulate, the release of renin that the kidneys would normally do.
Right.
Okay. So your kidneys are still going to be responsible for the release of renin in terms of regulating your blood pressure, if that's still there.
Right. So, again, that is hemodialysis. And there is a new trend that people can do this at home. They have a machine they hook up to. They can run it all at home. Still not overly popular, because I think it takes a lot of education.
And the other thing, too, is whenever you have access to an artery like that, frequent access, you also have a couple complications. One complication, anytime you're frequently puncturing the skin, is infection.
Right.
Infection can occur. We've talked about sepsis before in other podcasts, but sepsis is essentially an infection that gets into your bloodstream and becomes systemic, which means all over your body. Another complication with accessing an artery is bleeding. Mark, I'm sure you've been on these calls, bleeding problems at a dialysis center. Mm-hmm. You go there and those always worry me, because people who work in dialysis centers are good at stopping the shunts from bleeding.
Right.
So when they can't get it and they have to call us,
there's a problem.
Crap. And you can lose a lot of blood volume.
Well, it's a arterial bleed.
Mm-hmm.
And your arteries are under a tremendous amount of pressure because your body's pushing the blood around your body.
Yeah.
Their heart is pushing the blood around the body.
Well, and the clamps that they use in these dialysis centers are fairly brutal. I mean, and by brutal, I just mean they do the job. And so if they're going to be
it's literally a pad on the site and a pad on the back of the arm, and it's just compressing as hard as it can.
Well, they also have like these C-clamps they'll use. Yeah. They look just like clamps in a wood shop.
Right.
And they literally clamp down on that artery to keep it from bleeding because it's dangerous.
Right.
It's dangerous. Although I will tell you this, every dialysis patient I've been on that's had a major bleed like that, calm as a cucumber.
Oh, yeah.
Yeah. Or passed out, depending on how bad it is. But, you know.
We're in the process we are. But no, they don't. You know, and the fact that they have to go there 3 to 4 times a week, 3 is probably the most common, but depending on where you are in your disease process, this is a huge disruption to their life. I mean, it is extending their life. I've heard nephrologists have conversations with patients and patients' family members about quality over quantity. You're not going to get any better quality of life because you're doing dialysis.
Right.
These patients are going to continue to become sick, and it's going to extend their life, which is an amazing thing.
Yeah.
Because without this, you would literally last less than a week.
Yeah.
Before your body became so toxic with waste that it couldn't support life.
Now, a lot of times this extension of life is to have someone live long enough to receive a transplant.
Well, real quick, before we do that, there's one other type of dialysis I want to talk about because I've seen it a number of times just recently.
Sure.
It's peritoneal dialysis. Okay. Which is more commonly done in the home. And basically, it can be done at night. Because you may have to repeat it multiple times a day. But you're basically using the peritoneum in the abdomen to filter out the distillates. You have a distillate that is pumped into your abdominal cavity, and it draws out through the colon.
Oh,
what's needed to be taken out. It's not as effective as hemodialysis in the machine. And sometimes it has to be repeated up to 4 or 5 times a day. But they do have automatic machines that can do this for you while you sleep.
But if and when we're talking about quality of life,
right,
that seems like an advantage to this method.
Right, you don't have to go to this building 3 to 4 times a week for multiple hours of the day. But you're also not going to be, traveling the world either. Yeah. But you can at least stay home and be comfortable. And so your quality of life may be improved. Now, I also don't know where the cutoff point comes where you're like, oh, okay, you can no longer do peritoneal dialysis.
Right.
You have to go to hemodialysis.
Well, and I would imagine that's going to be based around how far you into the disease process. Right. How much filtering do you need?
Right.
That kind of thing.
So, okay, so Chris, transplants.
Yeah, so getting a transplant. So, like we'd mentioned, the kidneys, they don't heal well. Once they've been severely damaged, oftentimes your route to success, if they've been severely damaged, is going to be a transplant. Mm-hmm. Now, Mark and I both know someone that has received a kidney transplant. Mm-hmm. And hearing him talk about it is actually something that, I wouldn't say that, Mark, you should go bother him about it, but if you hadn't heard his story about it, what ended up happening was he was just getting sick. Mm-hmm. And he got some blood tests done, and initially they actually missed it. They got a blood test done, and then they got him.
He was pretty young.
Yeah, well, they got him swapped with another patient.
Oh, really? I did not know
that.
Yeah.
And so they called one patient saying you're in kidney failure.
Right.
And they called him saying you're fine.
Right.
And then
they had an awkward couple of phone calls I had to make.
Yeah. Well, so then they figured it out. Mm-hmm. And then his next step was you have to find a donor.
Right.
Okay. And a donor has to be compatible. Now, thankfully, although it is very important that you have a compatible donor, it's not as hard as finding, say, a bone marrow transplant donor.
Right.
It's not as specific, but people typically still start with family members to be the closest match.
Right.
So he had to get on the phone and ask someone to take a huge risk. Mm-hmm. Can you give me one of your working kidneys?
Right. I mean, the benefit of the kidney system is that you have 2.
Exactly.
So if one does get damaged, you have the other one to pick up the slack. Now that's not optimal, but it is functional. So if you decide, say
so
Chris
much better than dead.
Right. So say Chris needed a kidney, mm-hmm. I wouldn't give him one.
No, of course not. I wouldn't want his.
No, but if I give Chris my kidney, I now only have one kidney, so I now have to be very careful about damaging that one kidney.
Yeah.
Chris also has one kidney.
Right.
And owes me a bunch of favors.
God, I gotta buy every beer now.
Yeah,
Which, by the way, I don't think you should be on.
You should be doing if you have one kidney. So, this is, it's a huge question, and it can be a very awkward conversation because what if the person says no?
Yeah. Well, and then the other thing, too, is we talked about blood pressure regulation.
Mm-hmm.
That's going to be impacted by one kidney. You're asking someone to potentially go on blood pressure medication for the rest of their lives.
Or if they get an infection in that kidney.
Yeah.
Then they now have no backup kidney.
And they're going to be calling around. They can't call you.
Exactly.
But
no take backsies.
Yeah. Hey, got that one back. Remember that kidney I gave you?
So awkward.
Yeah. So... Now, go ahead.
I was going to say, also, just to keep in mind, they can use kidneys from deceased patients.
Yeah.
Kidney harvesting. But again, they have to be fairly compatible.
Mm-hmm.
And the chance of that happening at a time that you need it, in an area where you can get it, it's kind of more of a roll the dice situation. Whereas if you have a live donor, then you can kind of set up stuff to be compatible.
Yeah. So when they go in to put in your brand new kidney, when you get it, a lot of people kind of think, all right, they're just going to plug it right back in where it was.
No.
They don't. They actually tuck it down in the pelvis. And here's why. Here's one of the reasons why. There could be other reasons. Feel free to chime in. But as you have only one kidney, tucking it down in the pelvis is a little bit of an improvement on the design. It's now surrounded by a strong bony structure. So in the event of a car accident or any sort of trauma, your one kidney, which you're now much more relying on, is protected much better. So that's one of the reasons it ends up there.
Some of the other reasons I heard is that they don't take out the old kidney.
Oh, well, that makes that easy.
They leave one in. They leave that one in there, and they just basically replumb it down to this new kidney. And so going into the abdomen is a much less intrusive surgery as opposed to trying to get the kidney out of your back and getting through. It's much more specific, which increases or decreases healing time.
See, I imagine this was actually just invented by a lazy physician one day.
Right.
He's doing surgery. He's like, oh, fuck it.
Take it out. Here, we'll just put it here.
Put it in the pelvis. There's some
just
space.
put it right there. It'll be more protected. We'll tell them that.
Yeah.
So,
That sounds good.
But so they put this into your abdominal cavity, low in your abdominal cavity, down around your pelvis. So that A, it is protected. B, they're not having to retrieve the other one. It's a less difficult surgery and decreases the healing time. In fact, the patients can be up and moving around within a couple of days and out of the hospital within a week.
Yeah. So after they've been released from the hospital, the next thing they're going to be doing is getting some prescriptions. So as with any transplant, well, I'm not going to say any, I will say as with many transplants, one of the things we have to worry about is that the body is going to see this and may see this as an invader, and it'll attack it.
But, so one of the things that can happen is that your body rejects it. Your body can see this as a foreign invader, just like a virus or an infection.
Exactly. And when it rejects that kidney and the kidney ceases to function again, you're going to be in a world of hurt.
Right.
So
yes, they can put you on medications that you are, again, going to take for the rest of your life.
And these are immunosuppressants. And what an immunosuppressant means is pretty much what it sounds like. It suppresses your immune system. This comes with the added risk of making you more susceptible to other diseases.
Or infections, which can be a problem if it's your kidney that gets infected.
Absolutely. And this is the other thing, too, is and when you get sick, you get sicker.
Right.
You get sicker than other people do. It's very, very important for someone with one kidney taking these medications to practice strict cleanliness.
Right. Where are you going with that?
Yeah, that's it.
Okay. So, the kidney transplant is the best option for the long term. This person that we know leads a normal life.
Yeah.
So one of the questions that I read about on the kidney transplant website was, what about sex life? And a lot of these people will return to a normal sex life. So, yes, it is an improvement, but it's still not perfect for everybody involved. Now, one thing I did notice or that I did read about was that you will have a quicker healing time with a live donor than you will with a kidney from a deceased patient. It takes longer for the kidney to start functioning at a acceptable level.
I mean, give it a break, though. It's been dead for
Right,
bits.
exactly.
You know, chill out, Mark.
Right. Hey, come on. You want everything? I'll get to it.
Yeah.
So the other thing that can happen is trauma to your kidney.
So earlier I had mentioned about the arteries that feed the kidney. And this is going to be the immediate threat, the trauma to the kidney is going to be bleeding. So, like I had said, the renal artery branches off the aorta and it hangs onto the kidney. And unfortunately, when the kidney gets impacted, that's a lot of leverage on that artery. And that can cause rupture and bleeding. Secondary after that, though, trauma to the kidney, you're going to run into all the same problems that you had earlier with a failing kidney. Sooner or later, you're going to need the functions that the kidney provides. If your kidney has been traumatized, it's going to develop scar tissue. Scar tissue does not filter.
Right.
And so that needs to be replaced as well.
So do they consider if you have a laceration in your kidney, they call it a fracture because it's a solid organ.
Oh, really?
Do they do the same thing with a kidney?
You said kidney twice.
I said
Spleen.
liver. No, liver. I said the first time.
No, you said kidney.
Are you sure?
Yeah, it's
Are you
recorded.
positive?
No, I'm positive.
Back it up. No, if you have a laceration in your liver,
Yeah.
then they call that a fracture,
How they call it? Okay.
a liver fracture, even though it's an organ and not a bone. But
It seems to make sense, though.
right. So I would just wonder if they do the same thing with a kidney.
I don't know.
Can you have a kidney fracture?
Oh, I had no idea.
Well,
Can you, Mark?
I don't know. I'm asking you. You're the PS expert around here. So trauma. They actually have grades of trauma to the kidney, right? 1 through 5. Some of the things you're going to notice about the most basic one is called a bruised kidney. You know, this is where you've taken a blow. It's flank tenderness. You may be peeing some blood. Obviously, the darker the blood is in your urine, the worse the bleeding is. Makes sense. But diagnostic imaging tests such as a CT scan of the abdomen or abdominal ultrasound can prove necessary when diagnosing a bruised kidney. So grade 1, you have hematuria, which is blood in your urine, with a normal imaging study. These are contusions, non-expanding subcapsular capsular hematomas. Grade 2, non-expanding paranephric hematomas confined to the retroperitoneum. So you're actually getting some blood pooling in the area. Grade 3, go ahead.
I say, when they say paranephric, that literally means around the nephron.
Right. So grade 3, renal lacerations greater than 1 centimeter in depth that do not involve the collecting system. Grade 4, renal lacerations extending through the kidney into the collecting system, the
nephrons.
renal medulla, you just said it,
Yeah.
way to go.
Oh, sorry. I thought you were talking about what the collection system itself.
Trying to slow pitch you there, Chris.
Gotcha. It's going to be needed.
Swing and a miss. Involving the main renal artery or vein within the contained hemorrhage. Segmental infarctions without associated lacerations, and expanding subcapsular hematomas compressing the kidney is a grade 4. All sounds really bad. That's not even the worst one. Grade 5.
Obliteration?
Shattered or devascularized kidney.
Yes.
Yeah. Uretopelvic avulsions, which does not sound happy.
No.
Complete laceration or thrombus of the main renal artery or vein.
Gotcha.
It's grade 5. Let's stop there because I don't want to hear what grade 6 is.
Yeah.
They don't have one. That sounds pretty bad right there.
Yeah. Grade 6 is pretty much removal.
Right.
Where's a kidney? That's grade 6.
No, grade 6 is dead.
Yeah.
It's just dead. So, 13% of blunt abdominal trauma are. The kidney is injured in approximately 10% of significant blunt abdominal trauma. So you don't even have to be hit in the back. Right?
Well, that makes sense, though.
Uh-huh.
So let's talk a little bit about the kidneys versus other organs.
Real quick.
Go ahead.
Of those, 13% of those are sports related. When the kidney, followed by the testicle, is most frequently involved.
Yeah. So the kidney is a solid organ. And like many solid organs tend to rip and tear and shatter, as opposed to organs such as your lungs or your heart, which are more elastic. Okay, and those organs will bend and be able to stretch. Your kidney has no stretch.
Right.
And so when a force that would attempt to stretch it is applied, it'll tend to shatter. And so what can happen is, even if you're not hit directly where the kidneys sit, let's say you're hit from the front, or let's take a gunshot wound, for example. Okay, when a bullet hits flesh, what happens is it hits so hard it causes cavitation, and that's basically just a hole or a pocket that it makes. It's bigger than the bullet itself.
A cavity.
A cavity, if you will. And so if that cavity goes, if the bullet goes by the kidney, even without striking the kidney, that cavitation can cause trauma or cause an impact to the kidney, and because the kidney does not flex, it can shatter instead.
Right.
And so that is why you don't need direct trauma to the kidney to damage it.
And yes, they do call it a kidney fracture.
Oh, good. Perfect. Mysteries of the world solved.
Right. Right here on Medical Stuff.
By the way, that's mostly just a mystery to me and Mark.
Right.
Because obviously we Googled the answer. So.
You never know. I could have binged the answer.
You didn't.
No. Mainly because I'm on an Android phone.
Yeah.
And there's way too many steps in trying to get to Bing. So, what else do you have to say about the kidneys?
Got nothing.
Treat them right.
Yeah.
They are very, very important. Drink plenty of fluid. Contact your physician about any sort of diet changes you're thinking about taking. And because they will know best. And contact a physician about any sort of healthcare decisions. Don't take our word for it.
Yeah.
There's a reason we're not doctors.
Yeah. We're not that smart.
Exactly.
Also, take notice if you start seeing changes in your urine.
Right.
Deep, dark urines in spite of being well hydrated.
Right.
That's a problem.
Also, have your pharmacist, if you are noticing some of these things, and you're taking prescription medications, your pharmacist can tell you if some of your medications will cause that. There are medications that will cause a deepening in the yellow of your urine, just as part of their natural function.
Yeah.
So, again, seek professional advice.
Yeah.
Don't just please don't do it. We just didn't Google information, especially when it comes to your medical care.
Yeah. I think Mark and I have been on enough calls where people have worked themselves into a tizzy over internet research. Or the worst side of that coin is where they haven't called us because they've done internet research and said, I should be fine.
And now they're really, really sick.
Yeah. Well, this said to rub cinnamon on my nostrils, and that'll fix my problem.
Well, it fixed a problem.
Well, Mark,
your ability to smell, mainly.
Mentioned earlier, I am tired. I am done.
Okay. So this was Medical Stuff. I'm Mark. He's Chris. You can get a hold of us on the tweets at Medical Stuff, at Medside Stuff. MEDSIDESTUFF, or you can email us at medsidestuff@yahoo.com.
Don't forget to check us out on iTunes and Google Play.
And in 3, 2, 1, toast.